Good evening, everybody. As we wait for others to join, we will, start with our introductions. I'm very happy to have Meena and Arup Chakrabarti with me. So we are going to have a little chat with them about their journey together for so many years, both in their professional and personal lives. So Meena did her undergraduate and post-graduation from Trivandrum Medical College, and it's mind-boggling the subjects in which she's got gold medal. She's got gold medals in medicine, OBGY, pharmacy, pathology, microbiology, and she was also the best outgoing student of her batch. I happened to see Meena's YouTube video on maskology, and then I realized, it's the all-rounded interest in all subjects that has made her. It was really, as an anesthetist, I like to think that, I'm quite aware of everything to do with mask, but I learned a lot of new things by watching a video, Meena. And I have been watching your other videos broadcasting to general public. You speak in such measured. I know a bit of Malayalam, but I can't say I'm expert. But I can kind of understand. But you make it so easy and so accessible to a lay person who may be watching your videos. So Meena is a consultant vitreoretinal surgeon, and she did her fellowship from Arvind Eye Hospital. She's authored several chapters in books, and way back in 2007, I think she was one of the youngest recipients of the National Award for Prevention of Blindness because of her work in diabetic retinopathy. She follows her passion. She conducts several camps and awareness programs, and like I said, you can see a lot of videos of hers on. She's also currently the president of the Kerala Society of Ophthalmology. Welcome, Meena, and thanks for taking time out from your busy schedule. Uh, Both neither Arup nor Meena need introduction to ophthalmologists. I'm proud to say that I'm Arup's batchmate. And actually, he was a very quiet person in the undergraduate time, not at all like. So I don't know, Meena. Maybe later we'll talk whether he was any different when you first met him, because he was one of the quiet guys in my class. And now you wouldn't recognize the person who he is now. So Arup did both his undergraduation and post-graduation from JIPMA Pondicherry, after which he did his fellowship in intraocular lens and anterior segment microsurgery from Arvind Eye Hospital again. So he's actually, passionate teacher, and he's conducted more than 200 instruction courses all over the world. And he's a regular invitee to the American Society of Cataract and Refractive Surgery. It's almost like annual pilgrimage. You must have missed it this year, right, Arup? Because of COVID?
It is happening this weekend. It's a virtual meeting.
Oh, so you're going to miss the physical meeting, right? So, and there is not a place, where he has not gone to either give a lecture or conduct a workshop. And he's a proud member of the International Intraocular Implant Club. He had posted it on Facebook, and he was so happy to be inducted into that elite club. He has written 3 books, one of which is a joint venture between Meena and Arup, and he has 76 publications, 30 book chapters, and several awards. And he, if you again, you can see so many of his videos on YouTube, both on phaco and their complications. And I think one of his passionate his subjects is complications following phaco, which most of us think is a non-ophthalmologist think it's a routine surgery, simple thing. You go, they do the cataract within 5-10 minutes, it's all done, and then you go home and you're fine. But then there can be complications, and how you handle them, that is Arup's specialty. So with that much to introduce them, I welcome all the others who have joined us. We'll be recording this, and so that the other viewers in Learning General Surgery can see it later. So Meena, where did you first meet Arup? And how did you go from Pondicherry to Kerala? Seems like quite a long distance.
Both of us worked together at the same place at Chidambaram. That was way back in 1989 end. We met there at the Raja Muttaya Medical College.
What made you leave Kerala and come to Chidambaram?
I finished my MS a year earlier than Arup, and I was working in Arvind Eye Hospital for a year, and I wanted to do my DNB. So I thought I'd take a break and take a light job. That's why I joined the Raja Muttaya Medical College where I met Arup.
Oh, so you were destiny played a role in your meeting, I guess. So Arup, how did you land up? Everyone from JIPMA either goes to All India Institute or to US or UK. How did you land up going to Chidambaram?
See, the trend actually in the ophthalm department those days was, you go for your lab and all that. So my idea of going
Mute your
to
mic.
Arvind to get some time. Am I audible?
Yeah, you're
Now
audible.
echo is coming.
Meena, can you mute your mic?
Who is coming?
Now it's coming when you're speaking.
Is it okay now?
Yeah.
Much better.
Yeah. Yeah.
So the trend in JIPMA those days, was to go for the flap and push off. So that was my idea. And since there's no vacancy for senior residents at that time in Pondicherry in JIPMA, so I just thought I'll do my paperwork. It'll take a couple of months time, and then.
I think some echo is there. You'll have to switch off one
Maybe
device.
both of you can shut down one device and both of you could come in front of the camera.
Exactly,
Same
we'll do
one.
that. Yeah, you can just shut down the device. So you move closer. Keep it there. Yeah.
Just close the Zoom app in that. I think both of you will need to move back a little so that we can see you both. Yeah.
I think that is okay now.
Reasonably all right.
Shut down.
We don't see we are seeing less of Meena, but it's okay.
Yeah.
So you were saying that you went to Chidambaram en route for lab.
So this should be okay now. The echo effect must be gone by now.
Yeah, it's gone. It's perfect.
So I just decided to spend a couple of months time in Rajamutha Medical College and Hospital. So that time Dr. Puneet was working there, Dr. Bhargav and Dr. Puneet. So through that contact, and it happened overnight. Puneet told me that they're looking for eye surgeons in RMMCH. I said fine, I'll also go for an interview and went there. So my plan was only to stay for a couple of months till the paperwork is sorted out. And then, as Vidya just mentioned, there is a thing called destiny. So I met her, and then I got to know about Arvind Eye Hospital. Then we moved to Arvind, and finally,
Meena was instrumental in your landing up in Arvind Eye Hospital, is it? Wasn't on your plans before that.
Vidya, you're not very audible, Vidya. Your audio is.
Let's just look at that. Is it better now?
Maybe a little better now, yeah.
You're not able to hear me properly?
No, it's okay now, yeah.
Okay. So, what I was saying is Arvind Eye Hospital came into the scheme of things because of Meena. Otherwise, it wasn't in your scheme of things.
Yeah, absolutely. So my plan totally changed after I met her. And then she gave me a very good image about Arvind Hospital and the work that goes on there, and where both of us, could move on at the same time. So basically, the concept came from her, and then it clicked with me, and then one thing followed the other, and we both of us landed up. I first actually went to Arvind earlier because my contract with RMFCH was getting over earlier. So she joined a couple of months later.
So I was just for the fun of it, I had done a snap poll in Learning General Surgery about how many doctors are married to other doctors. So that seems to be a majority. At least 2/3 of doctors in India, including surgeons, seem to be married to other doctors. But when it came to the same specialty, hardly 10% of people were married to the person in the same broad specialty. So I understand it's fairly common among ophthalmologists. Is that true? That many ophthalmologists are married to each other?
Yeah, I think, it is not very uncommon in the field of ophthalmology. See, when I went to Chidambaram, marriage was the last thing in my mind. I never even thought about getting married and getting hooked up and get stuck in wherever it was. But it just happened, and then later on we came to know that and there were a lot of other couples. Actually, at Arvind, if you see that way, our my boss, Dr. Nachir, and Mina's boss, Dr. PN, they are also a couple. And then there are Dr. M. Srinivasan and Dr. Vijay Lakshmi. Again, they're a couple. So there are a couple of, so those were arranged marriage. I mean, they just were looking for the spouses and they got married. So for us, it was just, it happened, because of destiny and certain meeting.
So you specialize in intraocular lens and predominantly anterior chamber, and of course, Meena works on retina and vitreous. So, did you make a conscious decision that since you're both in the same profession, you should subspecialize in different areas?
Actually, my decision was my first love was retina and vitreous, what she's doing. So, since we had not learned much of cataract surgery, I mean microsurgery at Arvind at Jipmer, so I thought I'll just spend some time learning microsurgery in Arvind and then do for fellowship, VR fellowship, vitreoretina fellowship. So when I completed my anterior segment fellowship and approached my boss, she was aghast. She says that see, it is your wife is doing VR fellowship, which incidentally happened to be a first choice, and you should not think about that. I said, no, madam, I have to do it. I am very interested in that. Then after some time, I went to Dr. Nagpal, at Ahmedabad. Giridhar may be aware, Giri. So I suppressed that 1 year period in my CV that I had done anti-segment fellowship. So they're all very seasoned, very senior, experienced people. He asked me only one question. Okay, after your MS, what did you do? There's 1 year, there is nothing. So he caught me. That was the only question he asked me. He said, then I told him, look, sir, I wanted to do VR fellowship, and then why didn't you try it there? He said, madam won't give me. Then does madam know that you have come here? I said, no, she doesn't know. And that time, they were very close, Dr. Nagpal and Dr. Arvind Group seniors, and they're very close. So I didn't get the fellowship. So looking back, I mean, I am very grateful and feel that it was a very good decision for the seniors not to put me in the same field. Otherwise, we'll be competing with each other, and we'll be doing the same work. Now I can do the front anterior segment, and she can do most of the work in the posterior segment and the middle segment. So I think whatever happens for good. I was really very upset those days, and I was thinking about what next and how to do VR. But ultimately, I realized that what happens today, in due course of time, it becomes clear to you that that is the best thing that has happened to you. And at that particular moment, you may be really upset, you may be angry, you may be disappointed with life. But then in 5 years' time, 10 years down the line, it becomes very clear that there's a divine will, which basically took you the direction you went. So this is how it happened. She ended up in retina, and I ended up in anterior segment. And those days, it was very rare for ladies to do pursue fellowship in vitreoretina.
That's what I was coming to, Arup. Not about the lady bit. What I was saying is in the early 90s, posterior segment work hadn't really picked up much in India, isn't it? There were hardly any centers doing it, and equipment was we were way behind, probably 10, 20 years behind the rest of the world and all. So what made you actually it's with a huge population, anterior segment and cataract is like it's the bread and butter of most ophthalmologists, and it's a guaranteed job, and there is a lot of patients and everything. So what attracted you to vitreoretinal work after you did your ophthalmology?
VR was my passion right from the time when I was doing my post graduation. I wanted to do VR. I initially, when I completed my post graduation and went to Arvind, there was no vacancy there, so I joined as a medical officer. And before I resigned and joined Rajamutai Medical College, I had already applied for a VR fellowship. So the first slot that was available fell on me, and I joined. VR at that time was a little primitive. The prognosis for the cases that we did was quite poor. So there were very few takers for this profession, especially women, because of long working hours. The surgery was long. It took about 2.5 hours to complete a procedure. And there were very few women takers at that time. But it was my passion. So I got the necessary encouragement from my teacher, Dr. Namparimal Swami, and I joined for the fellowship with the first vacancy that was available.
So, and you haven't looked back at all. It's evident that your passion continues, and you haven't.
Vidya, the funny thing is, I mean, whatever I've kept as plan A in my life, it has never gone that way. I have always got plan B or plan C. My interest was retina, plan A. I didn't get that. I got plan B. And in many other facets in life, I have noticed the same pattern. So I've got plan B or plan C. But what I have decided is whatever comes to you, you just forget about what has been the original plan and try to make maximum use of what has come to you, whatever way. But this lady has whatever she has planned for in her life, A, B, C, D. I mean, she has always stuck for plan A. I mean, she has
I'm sure she didn't plan to. I'm sure she didn't plan to marry Arup Chakrabarti. I don't think she would have thought she's going to land up with a Bengali. Is that right, Meena? Did you ever think that you land up marrying a Bengali? Bengali live from Pondicherry, and whatever. Like
we are from the two corners of the country. It was never there in the agenda.
Yes, Giri, please.
I don't know, if maybe a little bit personal, but you can just reveal.
Giri, can you louder, please, Giri?
You need to come closer to your mic.
What was it in Arup at first sight that attracted you, Meena, Dr. Meena?
He wants to know what you saw in Arup in the early 90s or whatever, when you first met him.
Was it love at first sight totally, or?
Meena,
so,
this
Giri,
is Ravi. You're welcome
Meena
to plead the
answers
fifth.
this question, my children ask her the same question. It's a big joke at home. My son asks her the same question. My daughter asks her the same question. So I mean, I don't want to listen to that answer. I mean,
you can put on earplugs, no problem. You can put on your earplugs.
Close
your eyes, close your ears. Yes, Meena. It's Giri asking it, okay?
At that time was a very nice person to be with. I could speak to him. And we had almost similar interests in almost everything, starting from politics to the subject that we studied. So there's a lot of similarities in our nature, although I'm not very aggressive by nature, and I'm rather quiet. I like to remain in the background rather than push myself forward. That is basically the only difference between both of us.
Actually, it's quite, now that you brought it up, it's very unusual. There are a lot of Bengali Malayali couples actually. Somehow Malayalis and Bengali seem to gravitate towards each other. I myself in my friend circle have so many married to each other. But nevertheless, and this staying in the background, I think, is in metaphorically your posterior chamber and he's the anterior chamber. So he's in front and you're behind, but the crucial behind, without which the front can't function. So that's really nice. So once you finished your fellowship, what were your plans like, and how long was the fellowship? A year or two? How long was your fellowship?
Fellowship those days, 1 year duration. We wanted to get married at the earliest, but the dictum at Arvind that in most of the places you don't get married during a fellowship because there's all kinds of interruptions. So I remember, I used to finish my work about 6:37 p.m. and she will finish her work around 7:38. After that, used to go for a long walk. It went on for a couple of months. And one particular day, my chief, Dr. G. Nachir, she quizzed me during a surgery, took my history right from a birth till the day before. Incidentally, Meena was very, very popular with, everyone loved her. And, her nature is such that, everyone loved her. And they considered her as a daughter of, of the institute. And I was there, you have known me actually, so they would have thought that, what is happening? This girl, such a decent and such a soft-spoken girl, moving around with a vague fellow. So she asked me that, Arup, then I decided, I told her in the evening that it's high time we go to her house and reveal our long-term plans. So that evening, both of us landed up in her house, and Dr. Nachir, my boss, and Dr. P. Namperumal Sami, her boss. So we just told them that, basically we are waiting for the fellowship to be over before we get married. But incidentally, we got married during our fellowship, the 2 months, 10 months into our fellowship.
So you were telling that you told the story of your life to your boss. So let's hear some of it. What was your early childhood like? Like, how did you land up in Jipmer?
No, she asked my full background, I mean, the
No,
way
I'm
a
asking you.
good.
I am asking you about your early childhood. Did you know right from the beginning that you wanted to be a doctor?
Yeah, so right from the beginning, yeah, I come from actually a family. So it's a long story. To make it short, when we stayed 800 years, my family was 800 years was were put up in Bangladesh. Now what is in Bangladesh, but that time it was Bengal for 800 long years. And then 1947 happened, and then half of my family came over to West Bengal, and after the first Indo-Pakistan war that I think happened in 62, 63, rest of the family moved out. So my father did his schooling in Bangladesh, and rest of his studies in Kolkata, Calcutta University. And so basically the traveling is in my blood. I mean, we have been moving. I mean, for the last since 1947 onwards, our family has been on the move. So I think that particular, I think the I won't say it is in the gene, but somehow I got that particular
Aspect.
culture of moving from place to place till I settled down in Trivandrum, couple of I think two
Was your
decades.
schooling at Calcutta?
Yeah, I did my schooling actually in Agartala. Most of my schooling from class 3 to class 12. Agartala is in Tripura. My father was working there that time. Before now he's retired, of course. So it was quite a very hilly area. It was absolutely green, the wide open fields, ups and downs. There's a river behind my house, and it was a carefree life, absolutely. And my first interest actually was mathematics. So I had joined Indian Statistical Institute, and my father, knowing my nature, he pulled me out when I got an opening in Jipmer, and he told me that no, it is not right for you to go pursue a discipline where we have to join an institute. And knowing your nature, it is difficult that you'll be taking orders, from your higher ups. You have to be on your own. So that is basically what was responsible for me joining medicine. So that was again that was not my first choice. That was my second choice. As I was telling earlier, that was my plan B. And again, when I was doing after my internship, my plan A was general surgery. So ultimately, I ended up joining ophthalmology. Udi was telling me, he was in PGI. He used to call me the reluctant ophthalmologist. So the
Why
first
would
year
he?
of my.
Why was that? Why did you call him that?
Um, I don't know. Like Arup said, plan B maybe. I don't know. It just it was different. At least it seemed very different at that time. So based on how different people were doing different things. For instance, Vidya, you had decided anesthesia, God knows when, and the same thing was true of me. I mean, I was committed to pediatrics way back, whereas Arup grew into it, and how wonderfully has he grown into it. I mean, that's phenomenal. So he might have been reluctant, but he is certainly a flag carrying ophthalmologist right now. So
It so happened, I mean, after joining, most of my friends joined general surgery. So I purchased Christopher, I purchased Schwartz, all that. For last next couple of months, I read that. Till
I
Bhattu
remember
happened
that.
to us. Giri, you must be remembering Bhattu, no? Ravindra Rama Bhattu. Till
Yes,
till
yes, yes.
R.R. Bhattu happened, he joined as a MA student, and he actually brought in a lot of change. See, Uday, thank you for asking this question. Actually, so we have not really planned out in great details. We have just followed the flow of life, and wherever life has taken us, and we have tried to get maximum out of the situation that we are passing through. When we were at Arvind Hospital, of course, we had a fixed salary, and there was a lot of surgical opportunities, and that was a very crucial stage in our lives, because Arvind, that it was a renaissance time at Arvind too, because a lot of new projects were coming up and a lot of development was happening. It's better. I just
Sure, not a problem.
Yeah.
So I think this is better now.
Yes,
Yeah. But
definitely.
Meena, out of the frame.
Amina is coming back. Yeah.
Yeah. So Vidya, we just asked.
I
Arup
heard you.
how
I
they
heard
took
you.
the thing.
I heard you.
Okay, good. Okay.
So going to Arvind was not with the intention of staying on for a long period of time. It was just do a fellowship, and then wait and watch, and maybe take a decision. And then we loved our specialty so much, the working conditions so much there, that we decided to stay on. I continued as a consultant there, and Meena as a VR consultant. And there was an important training program that was happening at Arvind for the first time. It was Arvind Sight Savers Microsurgery Training Program, which came, I think, in 1992 or 93, soon after I completed my fellowship. So that gave me an opportunity to train a lot of people. So I could a lot of youngsters. There was a training of trainers program where people from the medical colleges. There have been some renowned professors who came for training of trainers program. Then fellowship, the various fellows when they're getting trained in cataract surgery. Then there was visiting fellows. Arvind used to have a lot of visiting residents from different places in the USA. Johns Hopkins, Wilmer people used to come down. Then Jules Stein, New York Eye and Ear Infirmary, Illinois, University of Illinois, Chicago. So all these people. So I was in charge of overall developing the training kind of structured program, and it was all because the management had given me enough support and enough backing to evolve a training program. So I think that was going on pretty well, and it went on till about 97, 98, and so then things started getting a little monotonous. For me, how long can you train people? And then, but Meena, of course, was enjoying, because Meena's boss was he had moved on to administration side, so she was virtually the head of the department, working under him. And but then it was a time for us to take a call that we needed more we had to be more practical, more pragmatic in terms of materialistic things, and which we thought will work out better if we start our private practice. And Meena incidentally happens to be from Trivandrum, and I am from settled in Kolkata now. But not much of roots. Though we have many friends who told me, "Arup, please come over to Kolkata. We will help you do this, do that." But then this thing is very risky. Once you go there and start doing well, things may not really be very. It may not continue in that vein. So
At
we
that
went to
time,
a
Arup, if I may interrupt, even till the entire 90s or even in the early 2000s and all, most people from Calcutta used to come down south to have even cataract surgery. It was like as if Kolkata, which has one of the oldest medical colleges and had a big history of teachers and surgery and all that. Somewhere something went wrong, and people coming all the way, catching a train and coming all the way to Shankar Netralaya or to Apollo or wherever to have cataract surgery. It used to be very strange to me. What was happening that time?
It was a flow act. What was happening is, of course, see, Kolkata Eastern Zone had given the early lead, but subsequently, ophthalmology was lagging behind in all of the country, and there are a few very great people, visionaries, took things forward. One was Dr. Badrinath at Chennai, who started the Shankar Netralaya. Dr. G. Venkataswamy, who started the Arvind group of hospitals. That time there's only one hospital, so he started in Madurai, and then Dr. G.N. Rao, after a couple of years, started at L.V. Prasad. So all these centers of excellence were coming up in South. And for some reason, this was not happening in the northern part of the country, other than RP Center, which was started off was one of the first centers, of excellence in the North India. Such a pattern was not seen in the Western India or Sri Lanka. He grew up in Pondicherry, so he's an architect. He has done a lot of work with the Arvind Group of hospitals, Coimbatore, and even Chennai also perhaps has got a good role to play. What's his name? Mr. Israel Gyanraj. So he has done the designing work for us, and we are very happy with the way he has done the building. Of course, he has taken the input from us, but net result has been very satisfactory from our point of view.
It's beautiful.
Was your original thing in the same place, or you completely moved?
No, Vidya, as I mentioned earlier, we have moved to place. We when we moved here, Trivandrum, actually we moved into a private hospital, which which had held a lot of promise for us. But then in 2 months' time, it was realized. The way it happens, we realized that if you have to work under somebody, it has to be a real big boss. Like Dr. Badrinath or Dr. Venkateswamy or big one, not under a smaller umbrella. So in 2 months' time, we decided that we have to go on our own, go up on our own. And so when we are in this stage of planning, so we had a lot of bank managers who were patients who came to us, doctor, you start off, we'll do this for you, do that for you. I remember one discussion with a particular bank. He came to a place and he asked us, just, everything is fine. We just need a few namke vaste collaterals. We said, sorry, we have nothing. We have absolutely nothing. Zero. We have zero. So we then ultimately we could not, so then his body language changed, his posture changed, he crossed his legs, he reclined, and all that. And now, of course, we are banking with the same bank, but it is reversed now, sort of. So it was we gone through that, and then Meena. So we had to start off with our cutting edge work, which needed a lot of investment, and somehow we got the money from multiple banks and multiple private lenders, etc., etc. And then we had the repayment was a big issue. We have never thought in terms of that amount of money, which was a monthly EMI. So this was something which was an absolutely new thing for us. Jipar hadn't prepared us for that. Arvind hadn't prepared us for that. My family, of course, we come from a very middle class background. So we never.
So if I may interrupt, did you never think of one of you continuing with the job while you started? You went full. I mean, when you decided to start something,
yes,
you just
absolutely.
jumped in with both your feet. You didn't since there were two of you. You never thought of one person continuing with the job when just to keep the home hearth warm, and the other person goes into adventure. No, not like that.
Nothing of that. We never thought about the consequences. What we wanted to do, we jumped headlong. I mean, now when I'm looking back, sometimes see, I just tell you what happened is then we needed the flow of money. So I started going to multiple places as a visiting surgeon. So I remember first month Meena used to Thursday evening I used to leave. So she will pack in a tiffin box with idlis and all that. So that lasts me 2.5 days. I lost. I think I went down to some 63 kilos to 70 kilos.
Meena, you need to send him again on these trips. Put on too much weight, so you have to start packing the increase and pack him off for a few days. Like
It was a tough phase, and but once in 2-3 months' time, once the flow of money began, and we realized that it was not a very rash decision that we had taken. We had not chewed off more than that a good bite. So things sort of normalized, and I started putting on weight, and all that happened.
So, Arup, can I just ask you a quick question? Did either of you think about understanding finances, like doing something, courses in accounting or economics or something like that? That's the biggest fear, I think, for most physicians to venture into where you have. So how did you guys manage that?
Yeah, so I think Ravi, it's good that you asked this question. So as regards understanding money, understanding the legalities, understanding all these, what do you call these, all these statutory things, we is big zero. All right, so we went, we took a decision and then we learned it. I remember, when we decided to go on our own, we had some patients who were builders and all that. So they helped us. We had multiple sittings with them, and the chartered accountants were there. But then we realized that many a time they just take you for a ride, and so we learned along the way. We made a lot of mistakes. We are not aware of certain certain licenses that have to be taken, certain registrations had to be taken. We are really not aware of that. We had some superficial idea, but how exactly to go about it, we were not really very well versed about it, and we learned it on the way. We have made mistakes from that point of view, and we have overcome them. And so, as Vidya said, it has been a risk-taking life all along, and it is not in my blood. It is not in Meena's the DNA too, and it just happened that we started off.
So how did the parents take it when you decided that you both of you want to quit your jobs at the same time and start your own place, and knowing fully well that the money is not there in the family.
I mean, see, we are not going to depend upon them. See, my father was in Calcutta, so he really didn't understand what exactly we are going through. And Meena's father, actually, he's a reputed scientist. Now he's no longer, because he was actually the contemporary of Dr. Ramakrishnan, our biochemistry professor. So anyway, so he also helped us, gave us proper contacts. I mean, if there is a doubt about certain statutory requirements or some other financial requirements, he gave us the proper lead, who are the right kind of people to meet. And so I think that definitely helped. But then so they're really upset about the rash things that we're doing. But then, I don't think they really put any obstacles in the way, and they let us do whatever we wanted to do. And it happened. So happened. In fact, for my wedding also, I just wrote to my father that I am getting married to Meena. She is so and so, and this and Meena. He was welcome in our household out of the blue.
I mean, they didn't know for 2 years that this was going on. They came to know only when you actually got married.
No, I mean a few months before marriage. Few months before marriage. Yeah.
So it was a well kept secret, huh? Not just from your bosses in Arvind, but from your family as well. uh, so how did you? I mean, you decided to start a private enterprise. When did you decide that? Along with that, you want to continue your teaching and research, and no, it's not easy, right? Trying to do both. So how did that
Yeah,
happen?
it is very tough actually. See, it is quite tough. Meena, would you like to tell about what we do?
For me, it was really tough.
Traveling.
Bringing up two young children, managing my career. My OT days used to start at 7:15 in the morning, sometimes go on till 7 in the night. And in addition to that, I was on call duty. And we worked in a private hospital in Trivandrum where I was on call duty, looking at all the injuries in the night. Sometimes Arup would have gone for surgeries elsewhere, and I would be alone with the children. And I have a call in the night. I used to take both my children, sleeping children, in the ambulance with me, put them in the doctor's room, and operate till around 2 or 2:30 in the night. Come back home with them. It was difficult, and but somehow we got through that.
You
But
never thought to
I
pass.
am sure your passion was so good, though, Meena, that you managed to transmit it to your children. So I think it's something very precious. I don't think it's, I don't think most children see that as a burden. So, I'm really very impressed.
See, earlier on, I mean, as regards the academics, I mean, when I used to go for the international meetings and stay with some close friends, so they will ask, Arup, you don't sleep in the nights? So I usually sleep, I can manage with very minimal sleep, 2 to 3 hours sleep in the night for maybe 4 or 5 days. So it was a tough period in the initial stages with the surgical work, and then post of follow-up work and family, and then whatever studies, everything happened in the night time, at the cost of my sleep, at the cost of my physical exercises. Of course, things have changed a little, but, have become better than before. But in the initial days, it was quite a struggle. Actually, it was try to find the right balance of the time for academics and stuff, and family, and your surgical clinical work. And the person who has sacrificed most for it is, of course, Meena. I mean, she is very much more brilliant than her academic record would say, and as a surgeon. But then somebody had to step back a little, take a little step back to look after the kids. I think she had done that, and I'm so thankful to you for Meena. And
You took the words out of my mouth, Arup. Actually, I was going to ask that there will be a time when it comes where with children and everything, somebody needs to take a step back. Otherwise, things are not going to get done. So I was wondering how you managed that and how you played catch up after that. So that would be interesting, Meena. Uh, what actually did you step back from, and how did you catch up afterwards once you had done whatever you had to do?
I have the ability to multitask. I can do multiple work at the same time, and I never cut on the time that I spend with the children. To me, my work was a last priority. I did my work after my children went to sleep, after they finished their homework. I was editor for the journal for a tenure of 4 years. It was a tremendous amount of work, going through the proof, reading the proof so that the journal comes out on time. And that work was done after the children finished their homework, they had their dinner, they went to sleep. And in no way, and looking back, I'm really happy that I took so much time out to be with the children.
So what are the children doing now?
We have two children. Our daughter is doing her final year MS. She's an ophthalmologist. She's going to be an ophthalmologist.
Oh my God. Okay. Another one.
One has completed his internship and he's preparing for his PG entrance exams.
So does he
He's
want
at
to be
home.
an ophthalmologist as well?
It looks like that.
I
I
suppose
mean, we don't actually tell them anything what to do, but the decision comes from them, because in all the struggle that they have seen, the people that their elders have put up before them, it makes more sense for them to go in take up ophthalmology rather than some other specialty where they have to again start from zero, start from scratch. So I think there's my son. I'm not too sure. He is not very keen, but I think eventually he'll take ophthalmology. That's what I feel.
no, because you both have big shoes to fill, right? So that will be a big deterrent. I mean, you are a tough act to follow. So they may not want to be another ophthalmologist, right? So I can understand where your son is coming from.
No, but by the same token, obviously they've also been inspired by their parents' passion, right? So that it's also there. So obviously it's a balance. It's a balance between, am I going to become my parent, or plus can I follow in somebody's passionate footsteps? So it's always interesting how these things end up eventually, but congratulations and our best wishes to two more of the Chakrabarti clan, the dynasty.
Anyway, I'm really thankful during this festive season. You took time out both from your work and your family to spend some time with us, and you're obviously an inspiration not just to your children but to so many of your students. I'm sure many of them who have trained under you are now doing very well in their career, and it must be very heartening for you to see your students doing well. So,
काफी चीजों
and
में दिक्कत वाटर लग रहा है
would you like to
नहीं आता
say something about that aspect of your life, about mentoring people?
Vidya, can you just coming into the last part of your question? This.
I mean, I just wanted to hear something about your mentoring others.
Oh yeah. So I mean, as I was mentioning to Giri, I mean, my father has been a teacher, and so that somehow perhaps run in my blood, and same thing about Meena. So it started off at Pondich at the Jipmer actually during our. See, I think the 4 years that I spent at Jipmer, 2 years DO and 2 years MS, had a very profound impact on the way I grew up. So we, on one hand, we had teachers who were very keen to teach, but unfortunately, fortunately, we had a lot of other restrictions in terms of doing investigations and the various Goldman 3 mirror or indirect ophthalmoscopy or fluorescent angiography. So there was a certain stage where we felt that our immediate seniors were cutting us off. So I decided that my juniors should not meet with the same fate as I have. So it started off from there, and then the same thing. I was very, with my own juniors and Pondicherry, I used to we spend a lot of time discussing cases and things with them. The same thing continued at Arvind, and this Sight Savers microsurgery training program. So that basically, I think, gave me a lot of opening in terms of picking up teaching skills, both surgical as well as non-surgical skills. Gave me a lot of contacts with lot of people. One thing I was very sure about is I'm going to be very honest and very serious about my activities. So if a surgeon is not doing well, I'll tell him. I'll give him a rap in his knuckles and tell him this is not the way to go about it. You have to alter mend your ways. And at times, there are trainees who went and complained to the higher ups. Today, the same people come and tell me, sir, without your help, my flourishing practice that you see today would not have been possible. So I had an option of taking over the surgery, finishing it off, and telling him that or her that you are doing a fabulous job, but it can be done little differently, and I would have finished it off, and I would have come home much earlier. My day basically was again from 7 a.m. to almost 11 p.m. It used to go in Arvind. Just a 2-3 hours break for my lunch used to be 4 p.m. to 5 p.m. and then teaching sessions, video recording, video editing sessions. So I think that gave me a lot of experience in terms of how to teach properly, how to develop teaching skills. And then after leaving Arvind, also when I started off on our own, there have been many youngsters, now they're in their 40s or maybe early 50s, who tell me that looking at your videos, we have learned this particular surgery, that particular surgery. Those days, I'm talking about 2005, 2010, we didn't have that much of internet. It was all VHS cassettes, all those cassettes. So now, of course, learning has become much easier. You have this YouTube and all that. But this is, if somebody wanted to learn a particular step, I would record it in my own surgery and edit it and send it off. So this is what we had done, and ultimately, I decided that I'm doing a lot of work internally in the country. So why not do something externally? I mean, in the international arena. So I started off submitting a course in American Academy 2006. So since then, every year I have had both of us together 4 to 5 courses we have got accepted, and those courses are basically popular because we very show out everything very honestly. A lot of teaching elements and a lot of take-home points, and those courses. Some of these courses have become brands. They have been running for 8 years, 10 years, 12 years. So those are brand. This is a Chakrabarti course and things like that. So I think all this have worked together to make us a good experience in this teaching learning experience, the whole thing, whole experience. Is it what I wanted me to talk
Yeah,
about?
exactly. Yeah, exactly what I wanted. So, Wait, would you like to say something? You need to unmute yourself.
Hi, Arup. Can you see me?
How are you?
Oh, very nice to see you. Hello, Meena. Very nice. I had logged in, but unfortunately, it was under another name. So I was there from almost this thing. Uh, Arup, very nice to see you. I mean, you're one of the people in our batch. There are many of them, but one of the people whom all of us are very proud of to say that Arup is my friend. Anywhere where we meet people in ophthalmology, we meet people in so many places. This you are one of the pride of our classes. So, and one thing I'd like to say about Arup is, for all that stature that he carries, the kind of awe he inspires among fellow ophthalmologists, with us, he's absolutely the same Arup that he has always been. That air and grace has never come to him, and we are very thankful to you for that, for remaining one of the double batch legends, and as playful and as witty as before. I mean, from looking at his face, I think wit is something we will not associate with Arup, but terrifically witty person. All of you will agree, I think, right?
Oh yes, absolutely.
So, Arup, I was just wanted to ask you if um, okay, that my train of thought got lost. I think Vidya, you continue. I'll come back to you again.
So Vidya, can I just add one bit? I just wanted to say that Arup and Meena are not just they're inspirations not just to the younger generation, but certainly to us as well. And I'm sure there are several of our seniors who feel that way, because they charted a path that was rather unusual. They managed to put together, private practice with cutting edge research, with teaching, and a generosity of sharing everything that they know, that it's really inspiring.
Actually, one of the things that comes up in the learning general surgery group always is that most surgeons don't like to impart their skills to. Well, there are a lot of rants. Of course, we were lucky we didn't have teachers like that, or at least I was lucky I didn't have anybody like that when I was training. But that seems to be a system where most people don't want this. Our teachers wanted us to be better than them, and that is the tradition that Arup and Meena are continuing. That they want their the people they are mentoring to be even better than them, if whereas that doesn't seem to be the case in most places. That is very sad. So it makes what you do even more almost noble, if I might say so.
In fact, when I first came in, both of us came to Trivandrum. There are many private practitioners who visited our theaters and asked to see surgery and learn surgery. So I mean, they are most welcome. Later on, when my other friends from other cities just heard this, I said, "Aru, are you mad or what?" So they're already established in their practice, and they want to come and learn and all that, and they're going to be a competitors. So I had actually not grown up looking at things from that angle. I mean, they say knowledge is to be shared, and if someone is, I mean, if I'm doing a good work, nobody can take my patients away. And on the other hand, if the other surgeon feels indebted to me that whatever good work that he has learned, he's doing is he's learned it by watching my surgery, by having discussions with me. He forever he feels indebted to me. I mean, it is always a win-win. I've never viewed things that by sharing your knowledge, your surgical skills, or by assisting somebody, you end up as a losing something in life. It doesn't happen that way. So with that, I just want to
It's
add
like
this.
happiness. Knowledge shared is knowledge doubled, I guess. We
Absolutely.
learn more when we teach than when we try to learn ourselves, isn't it? When you try to teach
Yep.
somebody, you learn even more. So
Yeah.
Giri, would you
If I
like to
may
say
add,
something?
Vidya,
Yeah.
sorry, I'll just. I think a lot of it comes from your confidence in yourself. A lot of people who fear competition are those people who just got there without having confidence in themselves. I think that's what is the main thing. If you, Arup is obviously very 100% sure about what he knows, what he does. So obviously nothing will affect him. He will impart knowledge without any. It's, if you look at a cross section of our teachers also, I think that's what it makes the difference. People who are not afraid to teach and uh, uh, impart knowledge to you are those people who are good in their job. And like Arup was saying, some seniors in ophthalmology who would cut you off. It's just plain lack of confidence or lack of ability.
Yeah,
Most
but
of it.
I mean, you cannot prevent anybody from learning. So my policy is
Exactly.
very, very simple. I mean, why should I not train anybody? If somebody wants to learn, he will learn by hook or by crook. I just cannot prevent him from learning. So I might as well be the person, helping him out to learn, so that
Exactly.
you have a friend for life. So there is
agree.
another actually Vidya we are talking about earlier. So out of a couple of cases that we did today, both of us had to do them together. So this is an advantage. See, there was a patient, one night patient, because of the COVID time, they have not been coming for follow up whichever hospital. So they came with a very advanced cataract and a detachment. So both of us, when I did the cataract surgery and then I stepped back, then she did the retina surgery, and so we are just thinking about it. I mean, having a in-house cataract surgeon and in-house retina surgeon, top of the line, definitely is a great value for the hospital, good thing for the patient. And we had another patient, Giri. It was a posterior polar cataract. He was a health inspector. Health inspectors are very, it's not a very
Powerful
big
people.
glamorous designation, but
But they're very important.
they're very important. So one health
Powerful
inspector
people.
came. So he had a posterior polar cataract, a huge posterior polar cataract, and these are the kind of cases where we have a PCRN nucleus drop and all that. So I had Meena around, in case I have I run into difficulties. She is always there to fish out the need and help me out. So that way, it has really been great help. That ultimately my seniors, Dr. Nachir and Dr. Nagpal decided that both of us should not be in the same field.
Yeah, ophthalmic jugalbandi, so to speak. So, your symphony once the children also join, it'll probably become a symphony. So, Nim, would you like to say something? Just unmute yourself.
Nothing special.
I name.
Nothing. Nothing special to say.
Then, if Giri, would you like to say something? Otherwise, unless somebody has any questions, we'll wind up, because I promised Arup I'll let him go at 8:45, and it's already 9:10 or something. So, Giri, any last words?
It is a little bit about politics also. Ravi and with their where Giri knows, I do a little bit of politics in our organization, but it's a different kind of politics. I basically still, I mean, the All India Ophthalmic Society has a hierarchy. So, I mean, if you want to do some good work for, there are about 25,000 ophthalmologists who are registered members of this society. So, you need to be an office bearer to bring ushering changes, do good things. So, I do fight elections in the society and have been spending some time doing these kind of activities too. But my election basically is not based on appeasement of people, and it happens everywhere. You see it in the national scene, you see it in every organization. So I'm still, I mean, speak my mind with everybody. Something I don't like, I speak it out, and something I appreciate. I mean, whoever it is, somebody who is my, not very close to me. I mean, I'm very, very generous with compliments to them. So this is something many of you may not be aware that I do some work at the society level too, All India Ophthalmic Society.
If you really
Yes,
want to bring
Ritu.
change, you need to get more people involved in it, right? So I suppose that's through the society you can do more than what you can do as a single person or as a single healthcare organization.
It is again difficult. What happens actually, Vidya, you may be knowing the Indian scenario. There are certain lobbies which dominate all the decision-making processes and all that. So I find it very difficult to get things changing, because until unless you have the majority of people thinking in terms of only the organization, only the society, and the betterment of the fraternity. I mean, we have group of people who think about how to make the society work for you, but then you don't. They do, I mean, of course, you have ways to not people talk in those lines. But I find it really difficult that sometimes it is there are a lot of obstacles that I have to overcome. But the effort is always there. Always trying to do change things, make things better for the fraternity.
So not only you,
Okay.
you've got Meena also involved in that, since she's now president of the Kerala Society. So what is it that you would like to do during your tenure as president?
I'm stepping down in a few days' time, November 22nd.
So what did you do? So what did you do during your tenure?
I had a project which which was on non-communicable diseases, especially non-communicable eye diseases. We had an intense awareness campaign which lasted almost a whole year. We have done quite a lot of work on that, and hopefully this will continue during the tenure, the next president's tenure, and subsequently Arup will be taking over as president and during his term also.
Year after, not this year. Year after.
Ladies first. Giri, final word from
I
you.
would like to invite Mukesh Porwal to say a few words. Mukesh, are you there?
Yes.
Hi, Mukesh.
Thank you, Dr. Giri. And I've been following Dr. Arup's work for quite a long time now. And he's doing excellent work. He's an excellent teacher. He has compiled tons and tons of videos. He has cataloged the presentations which are done in the All India Ophthalmic Society and various other meetings. And he travels a lot. He travels all around India, and he travels abroad. Right now in COVID times, obviously he has taken a break. But otherwise, I would say that he is one of the most prolific traveling teachers in ophthalmology. So we learn a lot from him. Thank you, Arupda. And I'm not in that much of touch with Dr. Meena, but I know she's equally good in whatever she does.
Thank you for joining us, Dr. Mukesh, though we couldn't see you. Giri, any last words?
Yeah, actually, I know Arup so closely. Probably in some aspects more than Meena. I don't know. If he opens his mouth, I can count his intestines like that. We have a saying in Telugu. So to tell everything about Arup, it will take maybe several hours. So Arup has always been a close friend, and after he got married, Meena and my wife Renuka also, occasionally we do meet. We have been to their house in Trivandrum. Rather, I don't think Renuka has been, but one of those things where you get along well without having to constantly prove that you're friends.
So thank you once again, Meena and Arup, for taking the time out from your busy schedule. Normally, we just say it for the sake of formality, but in your case, it's actually true. Two really busy people who agreed. All I had to do is send a WhatsApp message, and immediately Arup agreed. And I suppose part of it is because of us being from the same batch. But nevertheless, thank you so much, Arup, and hope to see you after COVID times in person. And a very happy Diwali to all of you. And we will have our next Marvelous Medicine edition next Thursday. Good night and stay safe. Be happy.
Thank you so much.
Thank you.
Bye.
Thank you,
Stay
everybody.
safe, yeah.
Thank you. Wonderful.
Thank you. Thank you all. Bye.